Hello, my name is John Sevransky, and I'm the editor-in-chief of Critical Care Medicine, and I am truly fortunate to have two world-renowned experts with me. Jose Pascual, who is the president of the Society of Critical Care Medicine, and Heather Meissen, who's an associate professor at the Neil Woodruff Hodgson School of Nursing and was the founding director of the NPPA Critical Care residency at Emory University. And we're here today to highlight a feature article from the March issue of the journal Critical Care Medicine, entitled The Definition of an Intensivist in the Era of Global Healthcare, 2024 Consensus Statement from the Society of Critical Care Medicine, Defining Intensivist Task Force. Dr. Pascual, can you tell me a little bit about why it's important to define what an intensivist is?
Thank you for having me, Dr. Sevransky. It's a pleasure to be here with Ms. Meissen as well. I think as you move on to practicing over years in the ICU, you realize that it's not a individual specialty, it's a team specialty. And then when you compare it to other specialties that are maybe not so team-based and are more individualistic in the specialty or the training and certification that the physicians undergo, then there becomes confusion not only for the team members, but also for the patients and the families at who is leading the knowledge that is being applied to their family member, who is leading the management, and who is the bedside provider. So I think just like has happened in cardiology, nephrology, pulmonology, and a definition is key here for all involved.
Thank you so much. And may I ask, you mentioned the team, and lots of the care of those who are critically ill or injured is delivered not by the intensivist, so by the team. Can you reflect a little bit about, again, why we should highlight one member of the team and how that fits in with the team-based approach?
Is that question for me, Dr. Sevransky?
It is. Thank you.
Okay. I would
But
love
I'm going to
hear.
ask Heather the same question in 2 minutes.
That's right. That's right. No, I'm not sure that it is that we're emphasizing one member more than the others. I take exception to that as well, as I think you do as well. But if we're going to define the word intensivist, I found it very interesting that in the article that you are talking to us about, this very important 20-year redo of the definition, at least according to FCCM, and there are other societies or other critical care provider groups, but at least with respect to FCCM's task force, a Delphi process, not an opinion paper only, came up with the fact that an intensivist, for one, is a physician. I was surprised. In fact, when that task force was called, we purposely made sure there were APPs in the group. I would have liked to see a bedside RN, non-APP, maybe more than one respiratory therapist and pharmacist. We did not have their input, but there were nurse practitioners at least in there, and they decided that the intensivist was the physician, which doesn't take away the fact that maybe there should be a definition for the other members of the very important team, but perhaps not as intensivist.
Thank you so much, Dr. Pascual. So Heather Meissen, as somebody who spends some of her time as an advanced practice provider at the bedside, can I ask you the same questions? Why is it important to define an intensivist?
Sure, thank you. And I also want to say thank you to Critical Care Medicine Journals and the Society of Critical Care Medicine for having me today, and also to you, Dr. Sevransky. I think it's very important, me wearing the lens of an advanced practice provider, having the definition of an intensivist allows us in part of those teams to know where we can focus our expertise and who we can talk to when we have patients who fall off trajectory. It improves patient outcomes by standardizing care and also by allowing us to access that critical knowledge that we need from the folks who have the specialized training, education, and that certification or the international equivalent as such. It really does help to streamline the process and improve patient outcomes.
Thank you so much. And if I can ask you the same question again, we've got a whole team there. Can you talk a little bit about your thoughts about defining one member of the team and whether it's important for other members of the team?
Yeah.
Are there special thoughts that you might have as somebody who is not a physician?
Sure, sure. And I do think that we should allow some definitions for other members of the team, but we should do it one step at a time while allowing for starting here. We already had a definition. It needed to be updated. So start here, define this intensivist role, and then move forward. In the nurse practitioner world, we have sort of moved in that direction with the national consensus model to define scope and standard of practice with our certification. As of now, the national consensus model requests or guides nurse practitioners to hold acute care certification if you're practicing in critically ill patient populations. That being said, we still have not reached that target benchmark, and we lack some of that certification for some of our providers, but we are moving in that general direction. Critical care nurses do have a certification that aligns with critical care, the CCRN. And I think that as we start with this process of defining the intensivist, then we can look to the future for defining other team members and their roles.
Thank you so much. So it has been my great pleasure to speak with Jose Pascual and Heather Meissen about some general thoughts regarding a feature article from the March issue of Critical Care Medicine, which you can see online, the definition of the intensivist in the era of global health care. Thank you so much.
Thank you,
Thank
both.
you.